So good afternoon, everyone, and thanks for joining us today on our February webinar. I'm Gillian Henderson, Head of Commercialisation with InnoScot Health. We run these regular webinars on the last Wednesday of each month, and they focus on a variety of topics, all with common interest themes for our innovators and partners. Today we are looking at innovations in public health, and I'm delighted to be joined by Nicola McCallum from Public Health Scotland. Nicola is Organisational Lead for Innovation with PHS and is going to talk us through their new Public Health Scotland Innovation Framework. Also on today's session is my colleague Frances Ramsey. Frances is one of our Innovation Commercialisation Managers. So just by way of housekeeping, today's session will be recorded, and you can find all of our previous sessions on the InnoScot YouTube channel, which you can access via our website. So we'll have plenty of time at the end to take your questions. Frances is going to be monitoring the chat, so if you've got any questions as we go through things, just pop them in there and we can pick them up at the end. So InnoScot's been involved in the health tech ecosystem for over 20 years now. We were initially set up by Scottish Government in 2002 to support the NHS to identify, protect and commercialise intellectual property from within the NHS. So over the years, we've worked in collaboration with academia and industry to bring technologies from within the NHS into the marketplace, into use and generating revenue and impact. We can engage with innovators at any point in that development process and at any point in innovation maturity with particular expertise at the early development stage. So we can offer evaluation, market analysis and health economic and budget impact analysis. But we do offer that comprehensive support across the full development life cycle, including assistance with regulatory compliance pathway for medical devices. And we're now able to operate more flexibly in terms of who we can work with, meaning that we can now work with any NHS organisation under contract with us. We can expand the offer of our services to non-NHS clients, including innovators, startups and international partners. And we can work on the expansion of our already growing consultancy service in regulatory affairs, commercialisation, training and investment readiness. So you can find full details of our work and those services on the InnoScot website. We launched our current innovation call earlier this month, and the focus for that is early stage innovators and early stage innovations. So for this call, we are specifically seeking ideas from early career researchers and innovators, but we're also focusing on ideas which are at a very early stage in their development or even on unmet needs. So we're looking for ideas that will improve patient care, quality, safety or health outcomes, or ideas that will increase efficiencies, affordability or sustainability within the NHS. This is an open call, it's not discipline specific, and the offer here is to help refine that idea and its positioning within the current care pathway through evaluation, market analysis, feasibility and alignment with current NHS priorities. So that call is open now and you can apply online using the online submission form. We do have a workshop session on the 11th of March where we can answer any questions specific to your eligibility or any questions that you may have about applying, and sign up for that session is open now, and I'm sure we can pop a link in the chat to that. I wanted to speak briefly about the Warwick-Edinburgh Mental Wellbeing Scales, as they are a really good example of innovation in public health and the translation of collaborative research into a commercial tool. So Public Health Scotland, or NHS Health Scotland as it was then, funded a collaborative research project in 2005 working with the Universities of Warwick, Edinburgh and Leeds to develop a mental health assessment criteria and tools. So 2 assessment scales rose from this, and they are known together as the Warwick-Edinburgh Mental Wellbeing Scales, and they've been widely taken up in the UK and across the world as gold standard tools for the triage of mental illness. And they offer a really comprehensive view of mental wellbeing rather than just absence of illness, and they reflect the extent that participants are feeling good and functioning well. So Warwick are the commercial lead for this programme, and they administer the use of the scales. They remain free to use for NHS and for research and teaching purposes, but charges do apply for commercial companies who want to use the tool. And InnoScot's main role here was to manage the assignation of the intellectual property to Warwick and negotiate fair financial return to the NHS. So the scales are in use commercially and they're seeing year-on-year growth. And in turn, this means that NHS Health Scotland, or PHS now, receives an income stream from them each year. So with that, I'm going to hand over to Nicola, who's going to share more detail on Public Health Scotland's new framework for public health innovations.
Brilliant, thank you very much. And just first off, a massive thank you to Gillian and the team for having me along today. So it's a really, really nice opportunity for me to come along and be able to talk about some of the things that we're doing in the innovation team and wider in PHS in terms of innovation. So yeah, so thanks very much for having me along today. In terms of what I'm going to talk about today, no, I'm not going to talk about cartoons, but I did just want you to bear with me for a minute. So when I was having a think about what or how I would position public health innovation today, I thought about a couple of things. So I tried to think of some useful analogies to help us think about what public health innovation is. So today, I'm going to talk to you about a couple of things. So you'll see there Lego. So I picked Star Wars because I like Star Wars, but in terms of innovation, I felt it was sometimes like having blocks of Lego. So a block of Lego on its own isn't necessarily useful, but thinking about Lego itself, if you have the different pieces which can be represented by data, partnerships, lots and lots of different things, if you bring some imagination to that, you can build almost anything. So that's kind of how I wanted to start, is that public health challenges can be insanely complex, but we can come up with some really innovative and really exciting solutions if we think about different ways of putting the building blocks together. Scooby-Doo, we were just having a conversation about this earlier. The Scooby-Doo is still relevant, but I hear lots of kids still watch it as well. So I wanted to use Scooby-Doo as an analogy because quite often the team of within Scooby-Doo, so those pesky kids, think they know what the problem is, but actually it turns out they don't know what the problem is until they've actually unmasked the monster or unmasked the villain. So actually a lot of the time public health challenges are like that. We don't actually know what the problem is until we dig a bit deeper and we look at things in different ways. And Wallace and Gromit, I'm sure everybody loves, but I just wanted to highlight Wallace and Gromit because actually they have got bundles of enthusiasm, but often their ideas kind of go a bit askew unless they have that kind of structure and support around them. So in terms of bringing all this together, what I'm going to talk about today is why public health innovation is important in the context of public health challenges, and then I'm going to highlight where we've got to, where we are now, and where we're looking to go in future. So I just wanted to bring that to the fore initially and just highlight that this isn't about novelty. It's about, for PHS, bringing a new kind of structure process to innovation that we're sharing internally and externally. Okay, so you will be, I think you'll all be very, very familiar with why innovation is important, and that's both in a healthcare context and more broadly. So when we first started thinking about the role of innovation in developing our new Public Health Scotland strategy as well, in terms of Together We Can, we really started to think about what does innovation mean to us, why is it important, and then in our role as a public health body, what is our USP and how do we really contribute and drive innovation across the system. So there's lots of reasons, some of which I've kind of pinpointed here at a very high level. I'm not going to go through every single one in detail, but as everybody will know at the moment, there's lots going on in terms of transformation, AI, public sector reform, lots and lots of different things we're all familiar with in terms of public sector financial sustainability. The system we work in can often be in silos, so you have all these kind of common issues and problems. They're not always necessarily issues and problems, but you have all these factors, and all these factors play a role in why innovation is important. Actually having the space, the authority, the autonomy, the risk to be able to look at things in different ways and think about how we might tackle things in different ways, particularly for Public Health Scotland, and that's really come out in terms of our new strategy. One of the main thrusts for us is in terms of inequalities. So as it's kind of highlighted here, I won't go through all the stats, but we all know that inequalities are getting wider and people are getting sicker. So for public health innovation, for public health and for innovation, it's thinking about how can we do things differently. If we keep doing things the same way, will anything ever change? So one of the things in particular in relation to public health is that actually we really focus on that kind of area related to social determinants of health, the building blocks of health. So before somebody even gets anywhere near a hospital, what are the things that are causing poor health? And you'll just see a kind of a selection of them here. So whether that be related to health harming commodities, whether that be related to food, whether that be related to employment, alcohol, lots and lots of different things, preventable conditions. So when we think about all this in terms of a big picture, that's really helped shape what public health innovation means to Public Health Scotland. And to really highlight that, so what we like to highlight is that 80% of what makes up someone's health is determined by what happens outside the healthcare system. So that's very much just kind of what I've just highlighted. So actually, when we think about public health innovation and how we're going to try and influence things in a really positive way for health and reducing inequalities, we really position ourselves as Scotland's national public health body kind of in this space. So we're saying, right, before anybody even gets to the hospital, innovation for us means thinking across these determinants of health, thinking where there's good practice, thinking where there's potentially some new ideas, how we think about new solutions, using a very structured process. How do we think about all this in the round in terms of making things hopefully better? And I just wanted to highlight, this is a bit of an older slide when we first developed the public health framework. But what I really wanted to highlight was in terms of that 80%. So we spoke a lot to our NHS colleagues across boards at a national, local level in determining, defining what innovation meant in a public health context. But actually we spoke to everybody else as well. So we went kind of across sectors and have continued to do so in terms of third sector, private sector, to ask what innovation meant and how did they view their role in people's health in terms of that 80%. So we thought building blocks of health. So if we speak to people in housing, we speak to people who work in employment, how does their views really shape how we think about innovation? So as I said, that's a bit of an older slide and just some of the people we consulted with in terms of development of our own innovation framework, and we've continued to do so. So we've made some fantastic partnerships from them, but I wanted to really highlight that actually it's not just the NHS and the role of the NHS, it's wider and how we all work together. So we feel in terms of public health innovation, that's everybody, that's where everybody can come together in this kind of space. So in terms of defining public health, what everybody really likes to see and what I've put in front of you there is a really kind of, I would say, a formal definition of what we define public health as. So we've said there about new novel solutions. On reflection, sometimes the word novel isn't actually the best. So that's something we reflect upon as well. But it is actually just thinking about that practice or that problem or whatever that challenge might be in a different way. So now I'm referring back to what I said earlier. But it is very much about that, and it's very much for us. As it says there, being something incremental or radical, and actually it's that real focus on that kind of lived experience as well. So it's bringing all that together, which is why in PHS we developed a framework and a pathway to facilitate this. So within Public Health Scotland, we've had colleagues, staff members who've had fantastic ideas in terms of innovation, but what we really wanted to do was start to formalise that process in Public Health Scotland, and actually how we do that out with partners as well in the context of our new strategy. So what I'm saying there is you've got that really formal definition, but in terms of our work over the last sort of 18 months, we came across this quote, and this is from, I think I'm pronouncing her name correctly, Alona Kickbush, and she's basically just saying what she thinks innovation is, and I really like it, because again, going back to that word novelty or going back to technology and things like that, we think of all of us that have different definitions of innovation, but we usually think about technology, immersive engagement, medical. But what she's basically saying here is actually, if you think about how we all live our lives, what do we all have in common in terms of, it says there, live, love, work and play in a good and safe environment. What are the things that we need to do to make sure everybody has that and we continue to reduce inequality? So in terms of what innovation means to Public Health Scotland, and actually what innovation means to me, because it means that something different, I suppose, to everybody, but hopefully all have that in common, that it's just an opportunity to think about the things we face in a different space and come together in a slightly different way. So innovation can be one of those words that can sometimes be really off-putting, but sometimes it can be really evocative as well. So for me, in Public Health Scotland, this is what we've really tried to centre around, is those building blocks of health. And actually just bringing it down to, yes, a solution might be technological, a solution might be medical, but how do we actually connect to people in the first instance? And that's that really key point, again, on lived experience and connecting with people in their communities. So very briefly, I've kind of summarised there what innovation means to PHS and why innovation is important, giving you the kind of broader context. So in relation to that, one of the things that we realised for our framework is, okay, so if innovation is going to be useful within Public Health Scotland context, in a wider public health context, how are we going to shape and drive that activity? So it needs to be structured in terms of the things that we're targeting our activity towards. So I suspect everybody will be familiar with Scotland's Population Health Framework and PHS's new strategy, Together We Can. So our mission in terms of innovation is to support both of those things. So that's how we've organised our innovation activities around the Population Health Framework's 5 key pillars of activity. So that very much covers kind of the different areas and the different mechanisms through which we're seeking to improve population health. And it really kind of focuses on that prevention agenda. Again, prevention can be one of those words that we talk about, but what we really want to start thinking about through a lot of our innovation work is we talk about prevention, but prevention in action is practical action. What does that mean? So that very much has led to our new innovation framework, which we published, I think it was last October. And again, these slides are there for sharing after, so I won't go into too much detail, but as I highlighted there, our vision for public health innovation was very much to, one, support the population health framework, support Scotland's ambitions in terms of reducing inequalities and improving healthy life expectancy. And our vision for innovation as well is to support PHS's own strategy. So we've captured that within kind of 2 key pillars. So that's our advancing innovative approaches to public health challenges. I don't know if everybody can see me leaning forward, that's because I didn't bring my glasses and I'm of a certain age. And our second pillar is building innovation capability and mindset. So in terms of pillar 1, that's where we're really focusing our activity around working with partners to look at what those public health challenges are and thinking about how we might address those. As I said, we developed our pathway to kind of support that work. So yeah, so there's kind of lots going on there. I'll come into a little bit more detail later in some of the areas that we're working on, but it's given us that real scope to look at partnership work and look at sometimes not just new solutions, but where there are solutions that already exist, so we can think about how we might amplify, scale and connect those. I think one of the things that we have realised quite quickly is that PHS isn't always leading in the space of innovation. Sometimes it's very much about using our role as a convener, as a national organisation, to bring people together and make those connections. So a lot of the time for innovation is going to be about listening. So I think that's something we've learned very well in the kind of last few months. So some of the conversations I've had with different organisations from different sectors, the work has been incredible and amazing. So it's really nice to see our role isn't always leading, but it's listening, convening, and it's about all of us working together. And then I've just said there very briefly in terms of pillar 2, that's not just focused internally, but that's thinking about how we build that capability and mindset. And with that, that's creating the spaces where people are already busy. So where time is limited, resources limited, it's been able to kind of create those mechanisms for people to be able to actually take the time an opportunity to be able to have a think and be able to make a contribution, because we all have that creativity in there. And as I said, I won't go into too much more detail, but our outcomes are very much aligned to what I was saying there around improving population health. And hopefully you can see there we're very clearly underpinned by some really clear principles around lived experience and being outcomes focused. So hopefully all the things that you would expect to see. And again, won't go through this in detail, but where are we now? So our framework was published, as I said, in October, and we're really starting to kind of move more at pace now in terms of, I can't believe I said at pace, everyone says at pace, move at pace now in terms of the team, my innovation team picking up activity. So you'll see there we had our first cross-nation event last year with NSS, so working with colleagues in Wales around a bit of an innovation exchange. That was a real kick-off moment. And then since then, we've been able to develop some fantastic partnerships, which we'll be announcing in the next few months with some fantastic agencies and partners in terms of thinking about some real key pieces of kind of innovation delivery. And then in terms of innovation projects, it's been kind of right across the sphere. So we've been looking at some innovation with regards to cervical cancer elimination, mental health in the workplace, some new work in social prescribing, green space, and some data tools for prevention. So there's lots of exciting things happening in there, and that's very much working around PHS's innovation pathway, which I haven't shared here because I felt might be too much detail, but it's in the innovation framework. And again, happy to talk to anyone in more detail about it. What I should really highlight is within PHS, there's already some amazing kind of key programs of activity that are by themselves innovative, is what we would describe as innovative. So you've probably heard of the Marmot Places, which involves, let me get this right, North Ayrshire, South Lanarkshire and Aberdeen City. So there's some fantastic work going on there, and we've got a prevention hub as well as a huge range of work going on across our whole system, modelling, medical imaging work, and some fantastic work in relation to arts and health. So I don't want to go on too much there, but in terms of upcoming, one of the key things in terms of upcoming, as I've said there, is not just around developing new solutions, but is amplifying what works. So we're absolutely on the hunt at the moment, and we've seen a lot of things where there are small areas of practice across Scotland where things are working really well, but how do we bring them to the fore, and how do we kind of make those connections? A real key thing we're focused on upcoming is in relation to partnership working. And so actually, in terms of those silos, sometimes it can be across private, third, public. Sometimes there's a real reticence in how we work together there. So it's actually thinking about what might we do there. So we're really thinking about that in the context of innovation and public health challenges. There's some discussions around national challenges and things like that at the moment. So that's really exciting. And in terms of, I've said there, but creating and maintaining an environment to share learnings, but going forward, that's a really key thing for us. So we're looking to bring together sort of public health innovation forum as well, with lots of different key partners from across the system. Internally, and we'll be speaking to colleagues about it as well. We're just about to launch our own entrepreneurship program for our colleagues. So that's hopefully bringing in insight and support from external organisations as well, and their kind of insight and their learnings to help our colleagues go through our innovation pathway, and hopefully that gives us a real structured process within Public Health Scotland to help colleagues get their ideas from A to B in terms of thinking about how we might test, scale and pilot things. So that's been really exciting for us. So I don't want to keep talking for too long, but just in terms of summarising, I've given you a bit of a flavour there in terms of where we're going. And it's really important to highlight, I think as I said earlier, we're not looking to own public health innovation across the system, but we're looking to help connect, enable and scale. But it's really important to us. So yeah, we want to be kind of clear and consistent in how we describe it. We want to work with national and local partners. That's a really, really big thing for us, is thinking about where do we connect, how do we connect, and what are we connecting on? And then that real focus at the end on practical actions. So I think we probably all spend a lot of time having discussions, talking, lots of important things, and how ideas develop. But what we really want to focus on with innovation and public health is practical action. What can we do? How can we test it? What can we learn? How do we shape that? How do we scale it? And how do we have the right people in the room to discuss these things? And that's very much, again, that focus on people who have lived experience across whatever lived experience that may be. And hope I'll kind of stop there and I'll take questions, but hopefully that gives you a bit of a flavour about why public health innovation is important, how we've defined it, where we've been, where we're going, and where we are just now. So yes, thank you very much for listening.
Thanks so much. That was great, Nicola. I think from my point of view, that whole piece around what innovation actually means and how we define it is really key, because I think a lot of people are put off with coming forward with new ideas because the assumption is that it has to be something new, it has to be something novel. We talk a lot about patents internally, but really the biggest differences are obviously often made just by that shift in practice and putting in place new ways of working. I think it's fantastic because we talk a lot about it, but to have Public Health Scotland come out with an innovator framework really sets the tone and that intention that we're actually going to move forward and give people space to try out new things. With that in mind, I've done quite a lot of work on innovator mindset, and I'm quite keen on how you plan to give people scope, capacity and encourage that innovator mindset. Is there any thoughts on how that could be implemented yet? Obviously it's a 10-year plan and you have just announced it, but quite keen to hear what the plans are around that.
Yeah, but I think, thank you very much for that, and I think that's really, really important. I think there's kind of 2 points to address it. The first one is, so I think I'd said that to previously, Gillian, my background isn't necessarily in innovation. I've only been in this space for 2 to 3 years. So when I came into post, in terms of defining the word and defining what it meant for PHS, it took me a wee while. So sometimes I think innovation is a really useful word, but sometimes I think it's not, because it can be quite a scary word and it means different things to different people. So yeah, I think a huge part of what I'm I'm trying to do, my team's trying to do, and PHS are trying to do is just break down the word and actually sometimes just put the word to the side. It's important because it labels the space, I guess, and lets us have the space to do things. But actually it can sometimes be really off-putting because you hear the word and you're like, oh, innovation, that's another, as you say, that's another novel thing. We don't actually have time for that. So actually, if I can use it as a mechanism, just to come into your second kind of question there, if I can use it as a mechanism to hold some space for people when people are really busy in their workday in terms of time, resource, you know, we have key priorities that we already need to deliver, then that's hopefully what that within public health itself a context that we can really use that word. In terms of internally how we're giving people the space to do innovation, we've tried really hard within PHS, although it is a kind of 10-year strategy and our kind of our frameworks there for kind of the next 3 years. We're trying really hard at the moment to focus on giving people permission, the opportunity and the space to do those things. So we've tried to put in place some more formal and informal mechanisms. So you heard me mention there around our entrepreneurship program. So that's a really small scale pilot program we're doing this year, but the idea is very much allowing colleagues the kind of space, they're supported with their time and the resource to bring forward ideas they might have in relation to a kind of public health challenge or their area of work, and thinking about some new practice, so they're then supported to use the innovation pathway to take their kind of idea forward. So we're doing formal things like that, but we're also trying to do some really informal things in terms of in the office, out the office, create some, you know, informal spaces where people can just have a conversation, or we just do topic days. So we're trying at the minute to keep it quite soft, more than too formal, but we've been really lucky to kind of have the support of the executive team as well. So it's been very much from kind of board and the executive team down in terms of allowing people to kind of have that space to think about innovation. So it's a real kind of key priority for us, and we kind of recognise that in terms of for things to shift, we have to stop doing things to allow us to do different and new things. So yeah, we've really had that support kind of top down and bottom up in terms of giving us the opportunity to be more innovative. It's a really slow drip feed process, and we won't always get it right, but hopefully kind of from the support that we're getting internally, the mechanisms we're developing, seeing where we're getting it wrong and trying things in different ways and kind of pushing sort of inch by inch, and really hope to give people the time, space and capacity a bit more in their working day to be innovative, I guess.
Had any questions from the chat, Francis?
Yes, so there's lots coming in about accessing the free Warwick and Edinburgh Mental Wellbeing platform. So we will try and include that with the webinar whenever we put details of that. So that will get investigated. Anne-Marie has a question. She's really interested in the social prescribing framework and the development around about that. And is there any PHS contacts working on that specifically? And that's putting you right on the spot, so don't have to say a name. No. Of
course, it's a really good question. Yes, I can absolutely give you a couple of contacts. That's absolutely not a problem at all. We've got a couple of contacts in terms of from our health improvement team, but also from our kind of consultants, a couple of our consultants who are leading that work. And Manira, if anybody's met Manira, will know our chief operating officer very well, so she's fronting a lot of that work as well. So yes, there are multiple people I can put you in touch with, and would be delighted to. In terms of social prescribing, it's quite early stages. So what we've noticed is, again, when I was referring earlier to some of that good practice, is that in terms of what social prescribing means and how it's applied across Scotland, it's very different in different places. So it means different things, it's applied in different ways, but we're thinking in terms of a kind of a pan-Scotland approach. Is there something that we can do to think about how we make social prescribing, the access to it, what it means kind of better for everyone? So that actually came from a lot of the discussions we've had with some fantastic organisations in relation to things like arts and health, and actually what constitutes the social prescribing. So what activities, what non-medical activities within the community setting are there? How do we support people? And actually, is there a consistent approach we should be looking at for across Scotland, or actually should we be looking at it in a much more kind of local level? So it's just some very initial discussions, but yeah, more than happy to connect you in, not a problem.
Good stuff. Another question coming in, interest about the Public Health Innovation Forum.
So yeah, very early stages at the moment, but we're looking to kind of launch that in sort of summer of this year. I'm saying this year because that's 2026, we're not in 2025 anymore. So yeah, so the forum is very much the focus is going to be on public health, so looking across those social determinants of health and thinking about how do we bring stakeholders together that aren't normally in the room together. So it's just going to be it's quite informal at the minute, and the aim isn't for it to be too formal, but it's meant to be a very kind of open forum where we can hopefully bring together stakeholders' ideas and things around about how we might tackle some of these kind of public health challenges on a small scale. But again, it's the idea of bringing that local and national together and just creating that space for people to talk, have that kind of soft conversation, see what sparks from it.
Well, that's good, because Natalie's also asking a question about how she can work together with Public Health Scotland as they plan the kind of up and coming kind of a work and things like that. So I guess you'll be advertising and.
Yeah, and Natalie, feel free just to drop me an email directly. I'm happy to set up a chat and have a conversation. That's one of the things we really hoped from today, and from some of the opportunities that we've been given, particularly from InnoScot as well, is actually just reaching out and connecting and talking to people. So a huge part of it is just talking and having those conversations and see where things connect and see where ideas come from. So yeah, no, we'd be delighted to chat.
And another question coming in about how do you plan to keep momentum after you've obviously just launched the 10-year strategy, to get Together We Can. So how do you plan to kind of keep momentum around about the space just now and kind of beyond?
Yeah, no, it's a good question. I think that would, I suppose, the current context very much speaks for itself in terms of kind of what's happening with health at the moment, with all the different challenges we collectively face. It probably sounds cliche, but it is more important than ever before, that actually, in terms of the pressure on the NHS and all the different pressures that we're facing, is thinking about very much that prevention agenda, and actually again thinking about how do we make things better for people in communities. So if we're going to help somebody much more upstream, then it saves somebody having to get to the position where they're engaging with the NHS for whatever reason. So actually, I suppose my answer to that would be, in terms of it speaks so momentum, what we'll continue to push that momentum and really continue to work with partners to help push that and really push the narrative now into, as I was saying earlier, about practical action. So we're talking about prevention, and we're talking about building blocks of health. We refer to these phrases and words, but actually, what does it mean, and what are we going to do in terms of concrete action, and how are we going to work with other stakeholders to do that?
Just talking about networking as well. So question, we have the capacity and experience through our board population health committees to draw from. Yeah, that was from Bob. I think we've covered quite a lot of it, really. It's all about kind of reaching out and watching this space and trying to kind of publicise and, like you say, keep things going.
Yeah, I would say, I mean, policy documents are quite frequently hard to get through, but do take a look. It's quite a concise document, lots of really good information in there. So if you're online, you haven't had a look through it already, do make sure that you take a look. I'm just going to share some slides again because I've got some. So if you do have any other questions for Nicola or the team, if anything comes to mind afterwards, do reach out and we can we'll be sure to get to them. Next month's webinar is focusing on female entrepreneurship and female-led innovation in celebration of International Women's Day. So do register and come along to that. We should have probably done that today, given that we've got an all-female panel today. Missed a trick. You can catch up on all of our previous sessions via our website, and if you've got anything that you would like to see us cover on these sessions, do get in touch and let us know. You can also book a consultation slot to catch up with your local innovation manager via the booking form on the website. And just a reminder about that session that's on the 11th of March for the innovation call, the workshop to help with applications. If you don't get our newsletter yet, you can scan the QR code, sign up now and keep updated on the next events and innovation news. Just finally, thank you so much, Nicola. That was fantastic. Best of luck with the framework. I look forward to seeing how things are going. So thanks for coming along today and giving us your time, and thank you to our attendees too. Thanks for coming along. Again, if you've got any questions, do reach out to the team.
Thank you so very much.